So I've had one friend, 2 staff members, and 4 patients ask me this week about plantar fasciitis, that condition that causes wonderfully, terribly sharp pain as soon as you get up in the morning and put your foot down on the floor. Or you've been enjoying your favorite TV show or reading your favorite book, you go to stand up after and you get that terrible pain in your heels. I'm Dr. Meagan von Holtz, and I think this week for the topic of the week we better talk about plantar fasciitis. So, what is the plantar fascia? The fascia, it's a fibrous band of tissue that attaches at the base of the heel and goes basically to the base of the toes, and it does a really good job of helping to support the 3 arches in each foot, the inner arch, the outer, and the transverse arch. Now, plantar fasciitis is an inflammation of that fascia. So something that causes that inflammation anywhere along that area is called plantar fasciitis. Most of the time people feel it right at the base of the heel, but sometimes you can feel it on the inside of your foot, or if it's bad enough, you can actually feel it all along the whole bottom of your foot. Now, what causes it? Honestly, there's a lot of different things that cause it, but to make it easy, I'm going to put them into 2 groups. One of them has to do with improper footwear, and the other has to do with some kind of injury. So, a lot of us lately have been wearing flip-flops. So cute, super easy to put on, but terrible in terms of support, right? Now granted, I am a chiropractor, so mine do have a little bit of support here, but if you think about it, if you're wearing a flip-flop that's totally flat and you have a foot that's already flat, or you're a hyperpronator, this shoe is not helping at all, and it's causing a lot of pressure on that fascia. So it inflames to tell you, hey, knock it off, stop. Wear something that's good for me because this is really bothering me. I've got other people who, it's the time of the year, you're out in the garage doing some work, or you're out in the side yard and no one wants to wear their brand new shoes. So you put your old shoes on, 3 years old, one of them's worn on one side, one of them's worn on this side, and after a while you can feel like you're not walking right and stepping right, and that can actually cause plantar fasciitis. Or we've got shoes like these, so great and yet so destructive at the same time. So when you go to put your foot in this, right away you can tell your arch is not normal. You're putting way too much pressure on your toes and you're not letting the arch work for you. But the other part is the calf muscle here, the soleus muscle. It really shortens or contracts, which looks really nice, but the problem is that muscle attaches into the heel. So if it's pulling up on the heel, it's also by default pulling up on the fascia, and that is what causes that inflammation. So first part, easiest fix for those is, take a break from those shoes, find something with good support. The second common cause of plantar fasciitis usually has to do with some kind of injury. And a lot of times it's not even to the foot. It could be to the hip or to the knee. So if you hurt your hip, or you've got osteoarthritis in your knee and you're walking funny for a couple weeks to a month, that abnormal posture can actually cause abnormal pressure on the fascia, and that can cause it as well. Now, what everyone wants to know, is it fixable? Can we help you? And the truth is, yes, certainly we can. A lot of it really depends on, though, why you have it, what it came from. So we usually do a detailed evaluation. There's usually 7 or 8 things that I do. Sometimes I do all of them, sometimes I do one of them. 3 or 4 of them you can actually do on your own at home. So I think next week what we'll do when we do the topic of the week, I will go over with you some of those solutions that we do here and give you ideas for what you can do at home. I'm Dr. Meagan von Holtz. Have a great week.